Hello friends, I am Dr. Vikram Jaggi. I am the Medical Director at the Asthma, Chest and Allergy Centers. These are specialized centers in Delhi and in Gurgaon, India, which deal with asthma, allergy, chest diseases, right from their investigations, their diagnosis, their treatment, patient education, research, etc. And today we are going to be talking about an important aspect of asthma, which is how to prevent asthma. All asthma patients know that they have very oversensitive air tubes. Their air tubes are like that of a touch-me-not plant. They react. They react to things which normally air tubes should not react to. This reaction results in inflammation, constriction, phlegm formation, which causes them to have shortness of breath, cough, wheeze, tightness, etc. So what are the allergens and what are the triggers of asthma? Allergens means something which goes inside the air tubes and creates an allergic inflammation, which is the starting point of the problem. These are mites, house dust mites, pollens, fungal spores, etc. and certain triggers, viral infections, emotions, temperature variation, sports, etc. So today we will be concentrating on the important allergens of asthma and the important triggers of asthma and how an asthmatic should learn and try to avoid these so that inherently the problems becomes better. Let us take the allergens first and let us take them one by one. The most important allergen for asthma patients is undoubtedly house dust mites. All asthmatics know that house dust is not good for them. Whenever they are exposed to sudden overexposure of house dust, whether it is a major cleaning in the house, whether it is Diwali cleaning, go to and open an old house, etc., that creates a problem for them. What is house dust? It is the combination of the scrapings of the construction material, the droppings of the skins of humans which inhabit that house, small food particles, some fungus, some bacteria, some fibers. These are microscopic, they are very small, they are very light, they float about freely in the air. In these house dust are certain small insects which are called house dust mites. They are not exactly insects because insects are six-legged. They are more like the cousin brothers of spiders because they have 8 legs, but they are very, very small. They cannot be seen by the naked eye. They can be seen under the microscope, and there are literally millions of house dust mites in any given room. Even in the cleanest of houses, house dust and house dust mites will be there. So what is in these house dust mites which causes so much havoc for asthmatics? It is their droppings, it is their shit, it is their body secretions, which when mixed with the dust, which when inhaled into the air tubes of the asthmatics goes there and causes a reaction which causes constriction and all the other problems. Interestingly, house dust mites don't transmit any disease. They don't bite human beings. For people who have no allergy to them, they have no problems with house dust mite. They only create problem for asthmatics who are allergic to house dust mite. So if you are allergic to house dust mites, and how to know that I will come to later, what can you do to minimize the exposure to house dust mites? Concentrate on the bedroom because that's where you spend the maximum time in your house. At least 8 to 9 hours of sleeping in the room. So concentrate on that room. Keep it as clutter free as possible because clutter allows the dust to accumulate. Heavy sofas, heavy curtains, velvety curtains, heavy upholstery, cassettes, CDs lying everywhere, open books lying here and there. These are situations where house dust mites will accumulate. They will also get into beds and beddings. So your own beds and beddings, show them sunlight, have them dusted, have your room vacuum cleaned, have it wet dusted by some responsible person of the house every 1 to 2 weeks, and concentrate on those areas which are normally not dusted. Dusting is not enough. This is not enough. You have to have it wet dusted, remove the dust from there. So these are some of the ways where house dust can be minimized by keeping the humidity below 50% by a dehumidifier. One can reduce the concentration of house dust mites. There are nowadays certain special covers available for mattresses, for beds and for pillows, which are impermeable to the house dust mites. So these are some of the simple practical ways to reduce the concentration of house dust mites. The next common allergen for asthma patients is undoubtedly pollens. Pollens are the white, yellow, small material which is on the flowers, which is on the weeds, etc. The flowers which are good looking, attractive, rose, marigold, etc. They have pollens which are rather big in size, they are very sticky, because these plants and these flowers are frequented by insects and birds, and the pollen stick to their body and they are carried here and there, and that is how they spread, that is how they germinate and new plants come out. The pollens of ugly plants, weeds, grasses, certain trees, they also have to procreate. They will not be visited by, the insects and the birds will not get attracted towards them. So nature has given them very small light pollens which fly about in the air. These plants produce pollens in abundance because they spread randomly through the air. They can spread miles through the air and they will drop everywhere, and if perchance they happen to fall on the female part of the same plant, only then they will procreate. So these very characteristics of grasses and weeds, their pollens create difficulty for asthmatics. Number one, they are very light. Number one, they are very profuse and they can spread anywhere, and when they are inhaled into the air tubes of people who have allergy to them, they create an allergic inflammation. How can we avoid pollens? It is quite obvious from the description that we have given above that it is not possible to make them zero. It is not possible to avoid them 100%. But something can be done. In the pollen season, the windows should be kept closed. When you are driving, keep the windows of the car closed. The pollens are found to be maximum in the morning hours from 6 a.m. to 10 a.m. Avoid going out at that time if possible. For example, for a long walk. Change the time of the long walk towards evening time. In India, we have a habit of hanging our clothes outside for drying on clotheslines. They will attract all the pollens and then they come into our house. When we come out from outdoors inside, we are carrying a lot of pollens on our clothing and on our body. So taking a shower and removing the clothes helps. The third common allergen for asthma patients are fungal spores. Fungi, molds are things which grow, which are fluffy growths, which grow in moist areas. If you have a bread lying in the kitchen for 2-3 days, you will notice a fluffy growth on that. That is the fungus. The seeds of the fungus are called fungal spores. They are also very light. So just like pollens, they fly everywhere, and once they are inhaled, they cause some problems. Fungal spores are indoors and outdoors. Alternaria and cladosporium are two very, very common fungal spores which create difficulty for asthmatic. How to minimize them? Avoid damp places. Avoid basements. If there is some leakage or seepage in your house, have it corrected. Old trunks, old raddi, things kept in lofts, old shoes lying for a long time, they will have fungus growth on them, and which is not good for you. My experience is that many people with fungal allergy have difficulties in what is a peculiar Indian habit of having a bed box, a box inside the bed where we store our things, keep stuff over there and forget about it. That is a place where sometimes fungus grows, and you can imagine that the asthmatic is actually sleeping in that, at least spending 8 hours in that. So concentrate on that, have it opened, show it sunlight, put them back in polythene, big polythene wrappers, or tie a knot around it, keep some neem ka pattas inside. That sometimes prevents future fungus growth. Sometimes allergies are due to pets. Cat and dog is very, very common. It's very common in the Western world. Fortunately, in India, it is not that common. When we talk about pet allergy, we immediately think about hairy pets and hair as being the cause of allergy. It's not so. It is their saliva and their urine which contains the allergens. But cats keep, licking their body, so the saliva gets onto their hair also. So if you have allergy to cat or to dog, the best of course is to get rid of the dog or cat or not to keep that, but that's easier said than done, especially in case of children. The minimum that can be done is to not allow the pet to come to the bedroom. Keep the pet outdoors. Certainly don't allow the cat or dog to get into the bed. Giving the pet a bath every 1 or 2 weeks also helps. People have tried to create hypoallergenic cats, breeds, etc. So far that has not been successful. A few words about another common allergen, which is cockroach. Cockroaches' droppings, their body parts, once they get mixed up in dust, also creates difficulties, just like house dust mite does. Children are many times sensitized to cockroaches. To avoid them, you have to concentrate on the kitchen, because that's the place where cockroaches live. And how do they come inside the kitchen? They come through drains. So on the drains we have normal traps which have got holes. Those are fine, but they are not good enough for keeping the cockroaches out. You have to have a trap in which there is a water seal, and then the water overflows, through which cockroaches cannot come. So have that done. Have your kitchen professionally treated for removing cockroaches, and for the future, don't let food particles or food items to be on the counters of kitchens at night. Keep the lids of the dustbins closed and keep the kitchen as neat and clean as possible. These are some of the ways of minimizing the allergens. So we have seen that these are the things, common things, which go inside, create an allergic inflammation, spread the dynamite inside the air tube, so to speak, and then on this dynamite certain triggers come and ignite the fire. These inciting or precipitating things are called triggers. What are the common ones? A very common one is viral infections. A viral upper respiratory infection, a flu-like illness, means fever, sore throat, cough, phlegm, and some tightness of chest. The fever becomes all right in 3 to 5 days time, cough becomes all right in 7 days time or so. This is the normal course of a viral upper respiratory infection. In Delhi nowadays, a healthy man or a woman would get at least 2 or 3 virals in a year. Children will get it much more. It is inevitable. But when an asthma patient gets a viral infection of the chest, he suffers more. His fever will become all right in about 3-4 days time, as is normal, but he will continue to cough and wheeze for weeks. Because his air tubes are oversensitive, the virus creates more havoc. This has to be expected, anticipated, and dealt with in a planned way. In this situation, an asthmatic need not immediately go on to antibiotics. He has to increase the dose of his asthma medication as per the plan discussed with the doctor. Viral infections will happen, they will exacerbate the asthma, and you have to learn how to control it. The control will come again and you will be normal again. Interestingly, asthmatics are not more liable to get viral infections, but once they have it, they will suffer the consequences for longer period of time. Another common trigger for asthma is exercise, sports activities. This is one trigger where we will say, don't avoid the trigger, do it, but equip yourself and prepare yourself. If the asthma is well controlled, then sports will not usually cause problems. So the first thing is to control your asthma well with medication. Some asthmatics will require an additional dose of bronchodilator half an hour or so prior to the expected exercise. Asthmatics can take part in all sports. They can lead normal lives. Many Olympic gold medalists have been asthmatics. In the Commonwealth Games in Delhi just concluded, at least 15% of the people who won medals, they had declared that they had asthma. So it is not preventing them from taking part in sports, in fact in excelling them. So you can do that. Another important trigger for asthma is cigarette smoke. Whether the smoke is directly you're yourself a smoker or somebody is smoking in your presence. For a person who has asthma, nobody in the house should be smoking in his or her presence. If a child has asthma and the parents smoke, it is it's almost a criminal negligence. One should just not do that, because smoke goes and creates difficulties for asthma, makes their control difficult, makes you take more doses of medication. So smoking and asthma just do not go together. There are no ifs or buts about it. There are some other triggers also. For example, sudden changes of temperature, going in and out of an AC environment, emotions, laughing, crying, general sadness. These also aggravate asthma and have to be recognized by the patient, and one has to try to avoid them. Diet also plays an important role in asthma aggravation. Many people with asthma say that certain food items cause problems to them. It is their observation. These are usually very cold water, cold drinks, fried stuff, achar, chutney, sauce, Chinese, Ajinomoto, vinegar, heavy or late dinner, eating rice at night, eating curd at night, heavy dals like rajma or maa sabar. These sometimes create difficulty, not through allergic means, but by physical means, which means they push up the diaphragm, making breathing more difficult, or they cause reflux of acid to come up in the throat, and when the person lies down, to go back into the already inflamed air tubes to create spasm. So the bottom line is that these kind of foods should be avoided, particularly so at night. So these are some of the common allergens and triggers. So the question arises, how would a person with asthma know what are his allergens and what are the triggers? Of course, through observation, but which pollen, which fungus, is not possible to observe that. That is best found out by doing what is called an allergy test or a skin prick test. The usual allergens are pricked into the skin, either on the skin of the hand or on the back, because back gives a very big area, and the reactions are observed. If a person is allergic to, say for example, prosopis, kikar, if you put kikar over there, there is an antibody in the skin already, there is an antigen-antibody reaction, and that part where you have pricked becomes big, just like you check for penicillin allergy. So immediately we get to know what the patient is allergic to and what he or she is not allergic to, and then proper precautions can be instituted. Having discussed so many allergens, triggers, etc., one thing which might have struck you is it possible to avoid them 100%? No, it is not. Does it mean we should not try? No, we should try. We should bring the problem from hair to hair by our precautions. But at the same time, we can't expect asthma to become 100% all right with precautions alone. There are many patients who try very hard, especially mothers of asthmatic children. And their expectation is also that, look, I am trying so hard, why is the asthma not coming under control completely without medication? That is not a reasonable expectation. So try, do what is possible, bring the asthma under control, reasonable control, but whatever is left behind, control it with inhaled controller medication. That is my message. Inhalers are safe. With a combination of sincere precautions and careful medication, it is possible to control asthma completely, and by which I mean no symptoms in the daytime, no symptoms at night. Lung functions are normal. Lung functions do not deteriorate with time. You don't have to miss school or work because of asthma. You can play, you can do whatever you want to do, and you are not going to get side effects of medication. That all is very much possible. That is called control of asthma. So with that, and with my good wishes for you to control your asthma beautifully in 2011, thank you very much.